come from a Navy family, going back generations upon generations. So both grandfathers, great uncle, mom, dad, brother, cousin, you name it. It was kind of like it's the Navy or I may have been disowned, I don't know. I got to Georgetown and saw that tuition bill, had the first aid financial talk, and called the recruiter that afternoon. I was in for 12 years. In between my internship and residency years, I served 2 years on a ship. I was in San Diego. I was on the USS Germantown, LSD 42. The Navy moved me from San Diego to Pensacola, the Navy hospital, doing my payback after residency. And we've stayed on the Gulf Coast ever since. And I never thought about being a doctor. We had no medical in our family. I think one of my great aunts was a nurse, and that was it. And I just knew I didn't want to be in business like my dad. I'm a type A personality, I give 110%, and I wanted it to mean something. You also tore your MCL. And I knew every day would be different, and it would definitely be a lifelong learning career and something that I would have a lot of satisfaction doing. I had played soccer all through college. I was always athletically minded and very involved in sports, and so orthopedics was always a big draw. You know, prior injuries and just battling that and trying to get back on the field, you can easily identify with your patients and be able to talk to them on a personal level because you've been there. Just being able to get people better. I mean, so much in medicine, and what I think drew me to the surgical side of it rather than primary care is these chronic diseases that you give medicines, you try to just kind of manage. And in orthopedics, we can actually restore people and give them back their quality of life. In sports, someone tears their ACL and you actually can reconstruct it and they get back to doing everything they wanted to do and were doing before they even injured their knee. I also
It's not moving separately.
see myself being more involved in the community as a whole with the female athletics.
Ligaments are fine.
I cover Alberta High School now.
Got hit in the ribs.
When I'm active with some of the other local high schools, especially with their women
No numbness or tingling in the legs or anything.
athletes and female sports, but definitely really targeting our female athletes, whether they're high school youth or adult, you know, and just our women that want to stay active.
I'm like, don't hit my ref. I've already operated on both his knees. I was worried about them taking out your knees
Oh,
again.
no. We're going to stay far enough back for that. I've learned my lesson.
In the military, it was very much a one team, one fight. I mean, you didn't have to compete to get patients. Everyone was in it for getting patients back to the field to be able to fight the great fight. And that's one thing with Gulf Orthopaedics in the private sector that is unique, that I don't see any of my partners as my competitors. It was just incredible that we could find 15 providers together in one, you know, southern Alabama, of all places, that just have that mentality. And so when we're recruiting, we're not trying to find the person with the best accolades necessarily, but just someone that also fits with us and fits with our mission and providing great quality care to our community, because that's why we're here. That's our whole purpose.